Or she could have got her on. She's almost there. Okay, so.
Hang on, just wait.
I've got it. All right. So good evening, everybody. We would, on behalf of the Omega Revolution, I would like to welcome you to our presentation tonight.
This is Deb.
I'm Deb. And this is
I'm Ray.
Ray. And we're pleased to be here, and we're pleased to be able to bring you Dr. Sharon Selmen. Dr. Selmen has a master's in clinical pharmacology and international clinical trials monitoring. She holds an international certificate for fitness and health coach, and she has worked on diabetes and heart failure medical scientific liaison. And we are super excited to have Dr. Sharon Selmen with us here tonight. And Ray.
That's exactly. We're so excited to have Dr. Sharon Selmen and Deb. And so we're super excited. She's going to be talking to us about inflammaging, and really what's happening in our body. And this is going to be a fantastic presentation. We are going to be allowing for questions at the end. So certainly get your questions ready, drop them in the chat below, and then we'll open it up. We're going to be honoring Dr. Selmen's time, but we'll be opening it up near the end to ask questions. So.
Okay, and also we will ask that people stay muted during the presentation. And this is a family show, so
I think we're good.
We're good. So
right,
thank you, Dr. Sharon. I will let you share your screen now.
Thank you, Ray and Deb, for organizing this session. It's my pleasure to be here today with all of you. And today's topic, it's all about chronic inflammation and the impact it has in our body and in our health. So I'm going to share my screen. Okay, so let's get started. First of all, not all inflammation is bad. There are two fundamental types of inflammation, acute and chronic. Inflammation is known as the body's attempt to protect itself by starting a healing process. Acute inflammation is the first line of defense against injury. Generally, it's a positive and short-lasting process, and it's involved mainly in healing and removing pathogens. This type of inflammation is characterized by changes in the microcirculation, which leads to the 5 signs we all familiar with, that it's pain, redness, heat, immobility, and swelling. On the other hand, chronic inflammation is exclusively a bad thing. Why? Because it has nothing to do with healing or protecting your body. It's indeed a very complex process because it has many cellular structures involved. To understand chronic inflammation, we need to get a little basic, and we have to understand first how are composed our cell membranes. Our cell membranes, as you can see in the image, are composed of fatty acids. And these fatty acids are a reflection of the foods we eat and the dietary supplements we take. And this composition has a key role in our inflammatory response. The membrane has several functions, such as letting nutrients in and waste products out. It acts as a protective barrier. It also enables the communication between cells, acting as a reservoir for fatty acids, and also this cell membrane is able to release fatty acids when needed, such as when we're dealing with an injury or for growth. The phrase "you are what you eat" applies on a cellular level. And why is that? For example, if we eat a diet with a lot of red meat, high fat dairy products, processed foods, and not much fruits, vegetables, fish, whole grains, nuts, and seeds, our cell membranes will be largely composed of unhealthy fatty acids from those foods. This will lead to less flexible and less permeable cell membranes, and this will have an impact directly to the ability to transport nutrients into our cells and to rid the waste. The cells will also have impaired ability to communicate with one another. And well, you may be wondering, how is this related to inflammation? Well, when our body experiences an insult, such as physical stress, allergy, or infection, our cells release the fatty acids stored in these cell membranes. The cell membranes containing a large proportion of fatty acids from a high red meat, high fat dairy, and processed foods diet will release pro-inflammatory compounds. On the other hand, cell membranes containing a large proportion of fatty acids from a diet high in fish, fruit, vegetables, whole grains will release anti-inflammatory compounds. The excessive inflammation and chronic pro-inflammatory state will lead to the destruction of healthy tissue, which will eventually surface as a degenerative disease. So who is at increased risk of chronic inflammation? If you are over 50 years old, overweight, have an imbalanced diet, if you're a smoker or exposed to polluted air, if you're a heavy consumer of processed foods, or well, if you are already diagnosed with a degenerative disease such as hypertension or diabetes, then you almost certainly have a level of chronic inflammation in your body that should be addressed to protect your long-term health. So there are 5 critical factors of inflammation. The first one, and very important one, is the imbalance between omega-3 and omega-6 fatty acids. Eicosanoids are the main hormones that control the inflammatory response. The body uses fatty acids from the food we eat to make these hormones. And as I explained before, omega-6 fatty acids found in processed foods and high-fat dairy products produce eicosanoids, or these hormones that promote inflammation. And the omega-3 fatty acids found in fatty fish have the opposite effect. They produce these hormones or eicosanoids that reduce inflammation. And the problem that we have right now is that we consume far too much omega-6 fatty acids and too low or too few omega-3 fatty acids. Therefore, the body is forced to use too many omega-6 to build cells, tissues, hormones, and this causes a balance in the body to become a pro-inflammatory and prone to disease. The factor number 2 is getting not enough fruits and vegetables. And this is a critical factor in chronic inflammation because they contain, amongst other beneficial compounds, polyphenols. And polyphenols have a powerful antioxidant and anti-inflammatory effects on the body. Why? Because these compounds are one of the main role or function is to block the key enzymes that drive inflammation. Canada's food guide recommends to take or have 7 to 8 portions of fruits and vegetables every day. The third factor is pro-inflammatory cooking methods. Popular cooking methods such as broiling, frying, roasting are not as healthy as we may think. And this is because when proteins are cooked in a very high temperatures, the protein binds with glucose or other sugars in our body and produce very harmful compounds that are aging and pro-inflammatory. Fortunately for us, our body can eliminate them, but when we overeat these compounds or these type of foods, then our body can't keep up with the elimination process, and it can lead to several diseases, such as diabetes, heart disease, kidney failure, etc. We should aim to choose cooking methods such as steaming, poaching, and boiling. The factor number 4, it's being overweight or obese. Obesity and being overweight are major causes of chronic inflammation because the excess fat will produce pro-inflammatory hormones. But there's a good thing about eating phytonutrients such as carotenoids and polyphenols is that with a diet high in these compounds, then in a certain way our fat is protected and will produce less inflammatory hormones. And the number 5, it's free radicals. I'm sure most people have heard that free radicals can damage your health, right? Well, free radicals are tiny particles formed during the countless chemical processes that take place in our body, and oxidative damage is the result of excessive free radical formation and a very low antioxidants level in our body. So now let's see what are the effects of inflammation in the body. First of all, we're going to talk about the heart. Cardiovascular diseases are the number 1 cause of death globally. Chronic inflammation is important to heart health because it will play a crucial role in the development of atheroma. Atheroma is the medical term for the buildup of a lot of material that adhere to arteries. Which material are these? It could be fat, cholesterol, calcium, inflammatory cells. And this buildup can accumulate over time, and it can narrow an artery enough that it can block completely and restricts all the blood flow, or it can produce a blood clot leading to heart attack or stroke. When we have more pro-inflammatory compounds and less anti-inflammatory compounds, the rate which atheroma is formed outstrips the body's ability to remove it. Diabetes is a metabolic disorder affecting the glucose status of the body. Over the years, increasing evidence has shown that inflammatory pathways are the principal common pathogenic mediator in the natural course of this disease. Having diabetes cuts life expectancy by up to 8 years. Diet and exercise play a crucial role to achieve better glucose blood control. And it's very important because diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco are ways to prevent or delay the onset of type 2 diabetes. What about at a cellular level? Chronic inflammation may be a causative factor in a variety of cancers. And this is because over time, chronic inflammation can cause the DNA to damage, affecting the way cells grow and divide. And the longer the inflammation persists, the higher the risk of cancer. Cancer is the second leading cause of death worldwide. Health Study was a study made in Europe that showed that the subjects following a Mediterranean diet, the risk of death from all causes was reduced more than 50% over a 10-year follow-up. So here is why I insist so much that what we eat really matters. And what about mood disorders? Depression is a leading cause of disability worldwide. It's a major contributor to the overall global burden of disease. There are several studies that support the association between mental illness and mood disorders and chronic inflammation, as well as a correlation between seafood and fish consumption and lower prevalence of mental illness such as depression or bipolar disorders. Omega-3 essential fatty acids, specifically I'm talking about DHA and EPA, are important candidates in the study of nutritional insufficiency that may increase the risk of suffering psychiatric disorders. An adequate dietary DHA intake is optimal for neuronal development and function. What about joint problems? Arthritis and musculoskeletal pain are the leading cause of long-term disability in North America. It's a condition that most of you know that relates to chronic inflammation of the joints, often resulting in pain, redness, swelling, and stiffness. There are a lot of clinical studies that have shown that omega-3 fatty acids and anti-inflammatory diet have a modulatory effect on disease activity, specifically on the number of swollen and tender joints. It's well documented that a healthy and balanced diet is essential for the correct function of every part of our organism, including the immune system. Some dietary factors are known to have immune regulatory properties, such as vitamin D or fatty acids, such as omega-3. The metabolites produced from omega-3 fatty acids have important immune regulatory functions. These metabolites are usually known as pro-resolving mediators, SPMs, and these SPMs are widely studied in most of the clinical trials directed to research in inflammation. And what happens here is that omega-6 and omega-3 compete for the same enzymes. So if we have more omega-6 competing for these enzymes, it will lead to more pro-inflammatory compounds than the ones anti-inflammatory compounds that omega-3 could create. About brain problems. Chronic inflammation is a significant factor. It has a significant factor in memory loss, confusion, disorientation, and decline of other cognitive abilities. Studies have shown that the highest levels of inflammation are associated with 3 times more likely to develop dementia. Inflammation is a central part of the entire process of aging. Inflammation is a new term that has been around the last couple of years. And this term referred to a low-grade chronic inflammation that develops with advanced age. And it is believed that this inflammation accelerates the process of biological aging and worsen many age-related diseases. It's an ongoing research that in the future we can talk about more about this topic. So we have heard all about the harm chronic inflammation can do. Now let's talk how we can fight this inflammation. First of all, and most important one, get your diet right. We have to end the hidden hunger. And what is hidden hunger? Hidden hunger is a form of undernutrition that occurs when we have our intake and absorption of vitamins and minerals are too low to sustain a good health or good development. We have to eat wild fish high in omega-3 2 to 3 times per week. We need to eat 7 to 9 portions of fruits and vegetables, and we need to aim to choose high in anti-inflammatory properties, such as berries, purple and black fruits, green leafy vegetables, mushrooms, etc. Carrots, peppers. We need to choose whole grains. If we're going to have cereals in our diet, we need to have them, at least half of them, that be whole grains. We need to eat less sugar and less salt, and less foods cooked at high temperatures, and way less processed foods. Number 2, take an anti-inflammatory supplement if you need it. To fulfill the daily requirement of omega-3, we should aim to have 2 to 3 portions of wild-caught fatty fish per week, as I said before. If we don't get enough omega-3 from diet, because this is very important, omega-3 is an essential fatty acid, and by this I mean you need to have it from outsource, like you need to eat it, okay? Our body cannot create omega-3 from the inside. So if we don't get enough omega-3 from diet, we should choose to take a supplement. For example, in my case, I've been taking omega-3 my whole life, and my baby takes omega-3 since she was 1 year old, and this recommended by a dietitian here in Canada. We have to exercise more. The American Heart Association recommends for healthy adults 150 minutes per week. This would mean 30 minutes per day and only 5 days per week of moderate activity. And what is moderate activity? It could be swimming, running, or riding a bike. Plus, we need a muscular strength exercise twice a week, such as Pilates, yoga, Tai Chi. And exercise will improve skeletal muscle mass, will improve insulin resistance, and our cardiorespiratory fitness while fighting chronic inflammation. If our body is busy with exercise and fighting insulin resistance, getting better fitness in our cardiorespiratory system, then our body is not busy creating chronic inflammation. Number 4, lose weight if you need to. Excess leptin in obese individuals is considered a contributor to low-grade chronic inflammation. And maybe you can ask, but what is leptin? Well, leptin is a hormone produced by fatty cells, and its function is to regulate this adipose tissue. But what happens in obesity is that we will have a decreased sensitivity to leptin, and then we will have an inability to detect satiety despite high energy stores or high levels of leptin. So if we don't have satiety, then we will be eating more, and then it's gonna be a damaging cycle, because we will eating more, and then we will weight more, and then we will have more inflammation, and it will be a non-ending cycle. And this can lead to a higher susceptibility to chronic conditions such as cardiovascular disease, type 2 diabetes, and autoimmune diseases such as rheumatoid arthritis. So, as you all know, we are living through a pandemic since 18 months ago, and I thought this was a very interesting information to share about COVID-19 and the use of omega-3. There has been evidence that patients after taking omega-3 supplementation have significant improvement with acute respiratory distress syndrome. This acute respiratory distress syndrome is the one that patients with severe COVID has. And a recent meta-analysis of over 1,000 patients with this syndrome concluded that omega-3 supplementation was associated with improvements in the ratio of arterial oxygen partial pressure, as well as trending to a shorter ICU stay and a shorter duration of mechanical ventilation, and a significant decrease in a mortality due to this syndrome. And all this information was a proof of concept to create an ongoing trial named COVID Omega F trial that right now it's running, and they have as an objective to establish whether omega-3 supplementation by IV route is a possible treatment option in COVID-19. And why is that? All the treatment that we have right now are addressed to fight the inflammation storm that we have in COVID-19 severe patients, but usually they use medications that suppress the immune system. So this trial wants to prove that using omega-3, they will achieve the same anti-inflammatory potential or benefit while not suppressing the immune system. So this can be a wide perspective of how important is omega-3 and how important is our diet for our health and our overall well-being. They will check outcomes such as inflammatory biomarkers. Also, as I talked to you before about the SPMs, these mediators, they will check and see how they change, and also the descriptive outcomes in terms of the days of hospital stay, ICU need, and mortality. So I hope I know this was a short talk, but I hope it can give you a very good understanding of how important our diet is. And please, if you're interested in getting a free eating guideline for omega-3 fatty acids, reach out into my social media accounts or my email, and I will be happy to send that to you to fight your inflammation levels. Thank you.
Wow, thank you so much, Dr. Sharon. This was really enlightening. I am fascinated by some of the things we talked about here.
Absolutely.
Diabetes, arthritis and inflammation, the hidden hunger. I kind of feel like that's a thing for me.
And
sometimes.
suppressing the immune system and the COVID-19.
Yeah, so fascinating. So we've got some questions coming before I ask mine. Gail had asked, oh, hang on now, we've got a lot here. I've got to be able to read it. Sorry. Okay, she said, is it important to know with regards to eating, like you mentioned, eating fish and fatty fish, is it important to know what food those fish eat and what type of fish exactly?
Yes, we should aim to have a wild-caught fish instead of farm fish because of the risk of mercury. The WHO organization says that the highest like poison in mercury is due the fish intake. So we have to choose very wisely what fish are we buying, because of the mercury they have. And for example, that's why a lot of supplements are made of small fatty fish, because small fatty fish eat algae and not big fish, and then they won't have mercury in that.
Right. So pelagic fish will be kind of like next in the food chain to be getting.
Yeah, like big fish, like they are like prohibit, like shark or those kind of fish, because they will have like huge amounts of mercury. Yeah.
So that was really interesting too, because you and I, we went out on Tuesday and we were at a couple of health food
Yeah, we
stores.
visited some health food stores.
And we were looking at some of the ingredients on some of the bottles of omega oils, and a lot of them contained fish gelatin extract.
We didn't even know what that was.
What would that be?
Well, I don't think it's natural.
Yeah, it was the other thing that we noticed, that there was a lot of almost actually every single omega supplement that we looked at, and we went to 4 different health food stores, their fish oil was mixed with sunflower oil.
Yes.
So I'm curious, like if we're looking at a supplement, what are we looking for? Like what's the best thing we're looking for?
Well, we should aim to look like the purest formulation.
Mhm.
Like most of them will be refined, and that will mean that the benefits of the properties will maybe be diminished. There is a very good one that it's balanced oil. I will share my screen again so we
Sure.
can talk a little bit about the. Can you see my screen?
Yes, we can see.
Okay, so balanced oil is a high purity, high potency essential fatty acid supplement. It's not a refined omega-3. It's as pure as having a very concentrated salmon, because it has a um, very difficult process in the formulation and creation of this in order to create a high quality uh, product. It is made from small wild fish, which ones are sardines, anchovies, and mackerel, that are fed with algae. It has high concentrations of EPA and DHA. Most of other omega-3, the one that I take before, it has only like 200 milligrams. That is nothing compared to what we need to take. And as we know, EPA and DHA help with brain function, mood disorders, mental health, fetal development. Like in pregnancy, it's a must that you have to take DHA, and during breastfeeding as well, cardiovascular health, muscle function, skin health. This balanced oil has vitamin D. Like all of you know that here in Canada, we have to take vitamin D daily. We can spare in summer only, but we need to take it daily. So if you find a omega-3 that has this plus, then you are kind of saving to buy a vitamin D supplement. And what it really makes so special this, and why I'm so prone to this omega-3, is that it has polyphenols.
Right.
As we talk about, polyphenols is found in fruits and vegetables. But let's be honest, like I have a very, very healthy lifestyle. I do exercise every day. I have a very mindful diet, but I don't have my 7 to 9 portions of fruit and vegetables every day. That I don't find the time to eat all those food, all that quantity. So that's why I think this extra ingredient make this formulation so unique, because this polyphenols helps with the oxidative stress and in every part of your cells. And I was living example of that, because it helped me when I had rhabdo and I didn't develop renal failure, and we think it was because of the polyphenols of this omega-3. So I'm sticking to it because it has helped my health, and because I truly believe in the science behind the formulation.
Dr. Sharon, I know I'm kind of putting you on the spot here. Would you mind sharing a little bit of your story with us?
Yeah, of course. Well, I was doing electrical muscle stimulation therapy. It's exercise that you have like electrical stimulation when you exercise. Um, it wasn't new. Like I'm used to do this type of exercise like from many years ago. And then one day I started with like 24 hours after my workout, I started with a pain, like very acute pain. I'm a physician. My husband is a physician, and we knew about the risk. And then we thought like could be rhabdo, and I told my husband like, should I go to the hospital? And he told me, but your urine it's okay. And I say, okay, you want me to wait until my urine is red? Then I will have renal failure. And he said like, okay, no, you have to go. And I went to the ED and I say, I need to get checked and see if I have rhabdo. And I did. My CK levels, the rhabdo, for the ones that doesn't know, it's a muscle destruction. And the muscle breaks down and it liberates some enzymes, like specifically CK enzyme. The normal range is less than 140, and I had 21,600. So I spent almost 6 days at the hospital.
Oh my
But
gosh.
all my other biomarkers were great, and really the doctors couldn't explain how well, like how bad, but how well I was. Like they like didn't make sense of my lab test. And then my husband found an article talking about polyphenols and rhabdo. It was made in mice, but it talks about the oxidative stress and the protection of the renal cells. So we said, like, I was in the hospital, I was reading the article, and we said, I don't know if balance will help and save my life, but I'm sticking to it for the rest of my life.
Wow, that's incredible. I had like chills
Yeah.
just listening to that. That's an incredible story. I'm so glad that you're better, and I'm grateful that you shared. We didn't, for those of you watching, we didn't let her know that we were going to ask her that because we didn't know we were going to ask you. But thank you for sharing. Do we have any other questions that came through on Facebook?
Nothing yet on Facebook there, but I did. So how do we know we're getting enough omegas in our diet?
Oh, that's a good question.
Well, we have a balance test, and that's a good way to know. What is about like good to have in this test is that, to have a test-based nutrition is that you can see that it's working. Whatever you choose, like whatever omega-3 you choose, you can get tested and you can see how your levels are, how your ratio of omega-6 and omega-3 is. So usually you have to have 3 grams of omega-3 per day, but you can translate this into food. It's very difficult because the food will, how explain, like your overall diet will translate in your omega-3 levels. It's very different than taking a supplement and knowing exactly what you're taking. So that's why with only food, we should take like a test and see how we are. And I'm pretty sure that only with diet, it's very difficult to be in optimal levels of omega-3, because unless you eat 7 to 9 portions of fruits and vegetables, 3 times per week fish, and I would like to know if someone does that really.
And not only that, it's going to depend on where your fruits and vegetables were grown, whether they were
There's a
organic,
lot of,
where the fish is
so much.
from, what the fish ate. Would that not all have a factor on the nutrients that you're going to get from that as well then?
Yeah.
Okay.
So before we close up, I just wanted to just say 2 things. First of all, traditionally, we always do a giveaway, which is very exciting with these presentations. So drop your email below so we can enter you in the draw. Second of all, if you are interested in receiving Dr. Sharon's nutritional information, if you just drop your email and then say, me or something, then we'll make sure that we share those emails with you, Dr. Sharon, and then you can.
Oh, perfect. Yeah.
Yeah, I think that would be great because what a tremendous resource to be able to have you go through and share a little bit about your nutrition plan. So
Absolutely.
we would love that. There we go. We've got me, please. So that's awesome. Yeah, drop your emails below and we'll make sure that we get that along.
You bet. Arthritis. I'll just ask a quick question there. My father has, really bad arthritis. He's been on the balance oil since January now, and his one hand is really good, and his left hand, he's still got some inflammation in it. But his results came back at 120 days, and they were still at I think 3.3 to 1. So that just shows that we still have ways to go to reduce that inflammation that he spent 78 years creating. Is that how that?
Exactly. You can't fight in 120 days an inflammation that has going on for 20 years, because imagine that this omega-3, it's substituting all the fatty acids in each of every membrane of our cells. So we have billions of cells. That it's a process as well. That it's not a magic thing. So he should be taking, and he won't stop taking balance oil. He needs to exercise, lose weight if he has a little bit overweight, all the things that it matters. That it's not only to take an omega-3, you have to have all the integral parts of your health: weight, exercise, diet, and the supplement.
So what would you say to as a physician, to somebody that's on the fence about whether or not they should take a quality omega-3 oil? What would you say to them to convince them that this is what they need and why they need it?
Well, while I was making this presentation, I was realizing that it's so much easier and cheaper to pay $50 per month for a great quality omega-3 than to pay the big cost in life, in quality of life, of having all these diseases. So, and I had goosebumps. Why would you wait until it's too late to have the power to change your life?
Love that.
So I would ask to them if they are having some of these factors of risk factors, or I will ask, how is your diet? How's your exercise? How's your weight? And where you want to be in 5 years, in 10 years?
Yeah.
Yeah.
That's a powerful one. Where do you want to be in 5 years? Do you even want to be here?
Yeah.
Right.
Yeah.
I mean, sometimes that chronic inflammation, it's just going to build up. We're not going to feel anything. And then all of a sudden one day we have.
Well, and I think what's interesting there too, is you said, for $50, this can be something that can really change your health.
Yeah.
And I'm embarrassed to admit this, but because I'm doing this call tonight and I've got little ones, I ran and I picked up pizza. So they're watching the hockey game and eating pizza. But that pizza cost me $50.
Yeah, exactly. We spend $50 in.
Yeah. So it really is about setting those priorities and looking at where we want to be. And
exactly.
Yeah, that's important. So, okay, well, this was so awesome.
Thank you for sharing with us, and thank you for being so open with us. We're going to unlock everybody so that they can say thank you. If I can.
Yeah. We're also, this will be downloaded and saved to YouTube. Did you unmute me? I did. Otherwise, and then we're certainly going to collect those emails and forward them over to you, Dr. Sharon, and then enter you in our draw.
And it'll also be going on to the Omega Revolution on as well.
Yeah, that's correct. So
So check
thank you
us
so
out,
much. If
and
you are
thank you,
unmuted,
everybody.
You.
thank you. We'll talk
Thank
to
you.
Thank
Thanks
you.
again, Dr.
Thank
Sharon.
you so much.
Bye-bye. Hi, Dr. Jordan.